Very good morning, Professor. This is Manpreet Virdi. Today, I would be talking about critical thinking in nursing practice. Over the past few years, critical thinking has appeared as the most competent talent in nursing, since it has arisen as a highly desired expertise for nurses to deliver the most proficient care to clients. Critical thinking has accelerated the advancement of current nursing practice standards and as a result has entirely transformed the nursing practice narrative in the modern world. This trait entails strong clinical judgment and clinical reasoning to give clients appropriate and exceptional care since it allows nursing professionals to evaluate all aspects of problem and determine the most correct response based on the facts that have been properly explored rather than on preconceptions. According to Liebold, the importance of understanding the concept of critical thinking and how to use it in clinical practice is imperative for nurses. Clinical judgment and reasoning enable nurses to associate, assess, and build linkages with existing facts, as well as analyze and interpret data from both a clinical and a logical standpoint. Using my experience during my nursing practice at the cardiac cath critical care unit, a patient was assigned to me after an angiography procedure and was being prepped for a procedure of percutaneous transluminal angioplasty. I administered Aptifib, a blood thinner, to the patient as per the doctor's orders. As I was a novice nurse, I panicked when the patient's blood pressure suddenly dropped. I applied clinical judgment based on my understanding and halted the Aptifib while rushing the normal saline to keep the blood pressure stable. Even though I addressed the situation, I got worried, which hampered my cognitive capacity to respond quickly at the moment. For almost a year, I have been working as a nurse. I am a witness to a lot of life or death scenarios, but instead of panicking, I use clinical judgment and logic based on my skills and knowledge to take immediate action. Clinical judgment is a quality that cannot be mastered overnight, but it may be improved via clinical practice in clinical settings. Clinical experience, I feel, has taught me how to use clinical judgment effectively in an emergency. The introduction of technology and the use of updated ways of practice has completely elevated the standards of nursing practice. Through use of intellectual capabilities in healthcare settings enables healthcare professionals to create and implement safe, high-quality therapies. Clinical reasoning and judgment assist the nurses in making the most accurate and timely choice possible during practice by comparing the options against the data and thoroughly examining the scenario. Critical thinking is an investigating tool, as educating strong critical thinkers necessitates the development of skilled nursing practitioners. Clinical reasoning is a method that is deterministic without being obstinate, evaluates without being judgmental, and is powerful without being opinionated. Establishing quick diagnosis, making fast, life saving treatment plans, avoiding superfluous investigations, examining the alternatives available, and eventually improving the client's status and condition are all advantages of strong clinical reasoning, as the unapproachability of right judgment during any critical situation could be life threatening to client. Nurses are skilled and highly recognized in modern nursing practice for implementing clinical reasoning in nursing practice while implementing a variety of competences such as evidence based practice, advocacy, autonomy, patient centered care, all of which influence nurses' decision making ability in certain situations. Contemporary nursing is highly advanced and has evolved so much with introduction of the concept of critical thinking, which has critical thinking, judgment, and reasoning, as it has improved the standards of nursing practice like never before. And it has also increased awareness of the need for good communication in healthcare settings. Clinical reasoning is a factual idea rather than a set of assumptions that allow nurses to determine the nature of patients' presenting state before focusing on problem solving approaches that can help determine the best course of therapy. I feel that practicing these abilities has assisted nursing practitioners in establishing accountability and improving nursing care standards, which is a significant accomplishment. Thank you.